very expert in venous hemodynamics and also in iron-related tissue injury.
Iron injury.
What I found in the 27 years of my research was that iron deposit is increased by venous function impairment. So if you do not have a good venous drainage, you increase iron stores. And iron stores is very dangerous when they are too much.
Because
yes.
What does it do? What does too much iron do?
Yes, because we have a very good system for storing iron, a safe system. But when the store are too much, our system are not capable to manage iron in the tissue. And iron in the tissue can develop free radicals. Free radicals actually may kill everything is life around. It's a very dangerous system for aging tissue, but also for tissue injury.
So the two things, the brains of patients with MS were not draining blood.
Yes,
and
iron deposition in the brain.
The two together.
Yes,
and
but the interesting thing was that iron deposits is mainly in the deepest part, so more difficult to drain part of the brain, exactly around the veins.
Oh, in the middle.
Yes.
Right in the middle of
in the middle part of the brain, exactly around the veins. And this, from the histology, the microscopy,
so
was completely equal to what I found normally in any other district of the body when I have problem of venous function, of venous drainage.
And what did you say? Aha?
Yes.
You said aha.
In my mind this was an unbelievable evidence that further study were necessary function on one side and iron deposits on the other.
So what made you go look at people's necks?
Really, I do not investigate immediately the neck. What I found was that in the cerebral vein, in many cases, I found opposite direction of the flow.
You found
yes.
the blood was going back up instead of draining.
No flow toward the heart, but flow with a chaotic displacement of blood in the brain, without possibility to empty. And at that point, I tried to investigate the neck. And this was unbelievable, because in the neck, I found blood coming from the chest and go again into the brain. And also, in some patients, I found directly by sonography the evidence of narrowing of the vein.
In the neck?
Yes.
So the blood was not draining?
It was not draining, was not passing regularly from the brain toward the heart.
And this is in an MS patient?
Yes, just in MS patient.
And then you started to test some more?
Yes, at
what did you find?
Point, I tested, probably this entire hospital was investigated for normal controls of different age. I used also patients with any kind of neurological disease for understanding this mechanism might probably make a role also for other disease, but I didn't find no connection.
So in normal people, or people with other diseases,
with other disease, neurological or not,
no narrowing.
No narrowing.
In patients with MS,
I found at the beginning a very high proportion. And by increasing my own learning curve, I was capable to find anomalies in blood flow in 100% of people.
So every single one
Yes.
of the MS patients had some sort of narrowing in the drainage
Yes.
veins.
And what is more important for me, and what we identified, was the physiology, the normality of the system and how the blood leaves the brain. We know exactly by a screening device like ultrasounds, we are capable to measure the physiology.
Mm-hmm.
And it's very interesting to know that physiology is present in any kind of disease, in any kind of people, except people with MS. So I think that this is a very strong evidence that anomalies in physiology of venous circulation.
There's some, yeah.
Yes.
In other words, in very simple
It's
terms,
a peculiar mechanism.
it's something different about MS, patients with MS.
Oh yes, it's absolutely different.
Yeah.
My suggestion to physicians that want to test this is to perform at the beginning not investigation on MS, but to investigate normal people, 50, 100 normal people,
And see what
so
they
to understand exactly what is the normal appearance. And after this little training, if you want to investigate MS people, immediately, you understand
You'll see it.
how it's different.
And this is what you called CCSVI.
Yes, I call CCSVI because
It's a new condition you
it's
found.
a new condition.
It didn't exist before.
No. This is a new vascular picture that was never described before during the
What?
and sometimes it was unbelievable because they have the resolution of the symptoms, the feeling in the operatory table.
That it stopped.
Yes, and they told us, now I have a normal sensation. I have a sensation of my hands. I have a sensation of my legs again. That's fantastic.
Right away.
Yes, after a few minutes sometimes, or maximum for acute attack in the space of 24 hours, 48 hours.
Every patient?
Yes, every patient with acute relapse have a resolution without steroids in a very little space of time. And this gives us the conviction that venous narrowing plays a role. Because if you solve narrowing, the acute relapse, the acute attack of MS, immediately is solved. Mm-hmm. So certainly the narrowing is a part of the symptom.
Why did you call it liberation? You call it procedure liberation.
Liberation was really coined by the neurologist, Dr.Zamboni, because I called him and I told, there are several narrowing, and we solved the narrowing. And the second time, he told me, do you liberate the patient from the narrowing? So we called liberation procedure.
But it has another meaning, doesn't it?
Yes.
It has a bigger meaning.
Yes, because at the beginning, the term was to liberate from the narrowing. And after the first cases in relapse, in acute relapse, with resolution of the symptoms, this was used in the openness that this operation could be useful for liberation from the MS.
Good term. Good term.
Yes,
How many patients have you liberated?
including also patients coming from US, there are actually 118 patients.
118.